Hello Bahamas! Have you ever heard of Chikungunya? If not, sit back and relax while I, Devin Lewis, Paris Bethel,
and Sasha Thompson of Biology 223 Section 1 tell you all about it.
We're here to spread knowledge and awareness about a virus called Chikungunya. Chikungunya is found in tropical and subtropical places and spread through the bite of mosquitoes, making the Bahamas a perfect place for it to proliferate.
Not only that, but chikungunya can be fatal to those with diabetes, hypertension, and heart disease, which are all very common in the Bahamas.
We believe that the Bahamian public should know more about chikungunya to prevent more outbreaks from happening, so that we can keep each other safe. Chikungunya is caused by the chikungunya virus, also known as CHIKV. CHIKV is an RNA virus, which simply means that once it enters a person or a whole cell, it makes copies of its own self. People become infected with chikungunya through the bite of mosquitoes. Chikungunya is mostly spread by two mosquito species, the Aedes aegypti and the Aedes albopictus. But you would mostly find the Aedes aegypti in the Bahamas. People become infected with chikungunya when a mosquito bites someone with the virus. The virus accumulates in the mosquito and is transferred once it bites someone else. When someone gets infected with CHIKV, symptoms start to show after 3 to 7 days. You may see signs of severe joint pain, fever, headaches, rash, muscle pain, and fatigue. The main symptom of chikungunya is intense joint pain, which can last for weeks, months, or sometimes even years. Chikungunya was first introduced to the Bahamas in 2014. Over a 6-month period, 781 cases were reported, especially from New Providence, where 81% of cases were reported and confirmed. Thankfully, this was considered relatively low, with no deaths being reported. Anybody can catch chikungunya. Those at higher risk include those that are immunocompromised, the elderly, and newborn infants. In the Bahamas, temperature, humidity, and heavy rainfalls are all environmental factors that play a large role in mosquito populations. The Aedes mosquito species is common in New Providence, as they thrive in densely populated urban environments with stagnant water sources. Some of the most common diseases among Bahamians are diabetes, heart disease, and hypertension, especially among our elderly. Chikungunya can be especially fatal for those with these complications, and that's why it's best we prevent it.
To prevent the spread of chikungunya, it is important we limit mosquitoes' access to standing water. We can achieve this by turning over anything that is open and contains unused water, such as
old tires, buckets, garbage drums and cans, toys, and pet water bowls.
killing mosquitoes with insecticides and spraying yourselves with insect repellent containing DEET or Bicardin are good ways to stay protected. Just always remember to use insecticides and insect repellents as directed. Using this form of protection is especially important if you or someone you know is planning on visiting a country with an active chikungunya outbreak happening, as they could get infected while away and bring it back to the Bahamas. Medical care should be sought out if you or anyone you know experiences a high fever, muscle pain, joint pain, or a rash. So, what's being done? As there have been no recent outbreaks in the Bahamas, no organization has spoken up about anything regarding chikungunya recently. However, there is good news and bad news. The good news is that a vaccine for chikungunya does currently exist. The bad news is that as of February 2026, the Bahamas does not have any of these vaccines fully available for Bahamians to take. Having the safer chikungunya vaccine available locally could prevent the fatalities of Bahamians who are more susceptible to severe reactions to chikungunya.
Toss, spray, keep the mosquitoes away.